Dockabo, towards a better quality of life.
My name is Becky. I'm one of the COPD specialist nurses for the St Helens Rapid Response team in the community. So patients are normally discharged from hospital as an early supported discharge. They are onboarded to the virtual ward telehealth service, and if they input their data and anything is out of the abnormality parameters, we have a telephone from the telehealth nurses to make us aware, and then we follow the patient up by telephone. So using remote monitoring today in practice has really helped how we prioritise patients, again by identifying their needs and if the saturations are low and if they were to need a hospital admission. But it also gives the patient more confidence within managing their own illness and their disease, so that they know that someone is monitoring them and they can identify if they are starting to decline within their health.
I'm Anthony McCormick. I've got asthma, I've got COPD, and I've struggled for years with my condition. As I get older, it's getting worse. It impacts it everywhere. Walking, living, moving about the house, restricted in everything I do. Literally everything. And
this has allowed him to remotely manage his symptoms at home, identifying when he is declining in his health and if he was oncoming an exacerbation, and we can prioritise that and we can deal with it and treat it as quickly as possible so it doesn't progress into anything further.
When the nurses first mentioned the monitoring system to me, I just thought, oh, it's just another ploy. It's just going to go on one of them database things, you know. But I was shocked because as you put your daily things in, if one of them's high or low, you get a phone call. Now, when I got the phone call, I thought, oh, it's not just going on a computer or something. There's actual people there. Well, my wife and my family thinks it's a good idea because my wife works part-time. Sometimes she goes out early in the morning. But it's peace of mind for her as well, knowing that I'm still being monitored. So if I take a bad turn or anything, there's always somebody going to phone me. And they do phone you, and because they phoned me a couple of times. My temperature was up one day, my pulse was up another time, and they phone you to make sure you're all right. And when that happened, to be honest, I was gobsmacked, and really I think it is a good thing, because I put them things in. I don't know if they're high or if they're low or nothing, you know what I mean? But the girls who get them do, you know what I mean? And so if anything's high or low or, anything's up with you, they phone you straight away.
It's put his health anxiety a lot at ease, knowing that there is a nurse predominantly watching and routinely looking over the data that he inputs over Monday to Friday has relaxed him, knowing that he's being monitored at home.
My name's Dr. Greg Irving. I'm the research lead for St Helens CCG. I'm one of the GP governing body members. Yeah, from a GP perspective, we all use the EMIS platform locally, and we found that using Dockabo in terms of interoperability worked well with EMIS. We were able to onboard patients efficiently and follow them up. We were still able to use our existing records alongside those of the Dockabo record, and I found that everything worked quite well together. Many of these patients are elderly and frail, and actually getting into clinic can be quite a challenge for these patients. So having the remote service was, for many patients, it was a real lifesaver. There were patients with multiple medical conditions who were being monitored as part of the service who didn't think there was anything particularly wrong, but as part of the monitoring had very low oxygen saturations, and they were able to be picked up early and receive the appropriate intervention and be managed appropriately. There's pieces that have been in the local news about it's saved my life. So patients who had COVID and were deteriorating, and they were able to access services very promptly. And there was a pregnant lady who got picked up very early. There was a elderly patient with multiple medical conditions who got early intervention as well, so his saturations were very low, but he wasn't aware. Yeah, the evaluations are really positive, and yeah, the individual patient comments are really colourful in terms of, it's overwhelmingly positive experience that they've had.
I would say to other services that are considering using telehealth that it's a great service to use. I know from my experience with it, I've been able to prioritise patients, provide A-star quality care because I've identified their needs quickly and we've treated them promptly and avoided hospital admission.
It's a peace of mind, it's, you know, and that's the biggest thing, peace of mind, knowing that there's somebody there. And that's why I said having this, it's a godsend. It really is.